Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Khalil A. Colonna, and this is Nashville. Dr. Matthew Walker was a talented surgeon who dedicated himself to community. He used his talent and knowledge to bring excellent health care to the people in North Nashville. But his impact reached beyond Nashville and beyond medicine as well. He trained aspiring African-American doctors from all corners of the country and was instrumental in the civil rights movement. Later this hour, we'll learn more about the medical center that bears his name and hear about what the man was like from his descendants. But first, about 24 hours ago, Governor Bill Lee signed a bill that caps the size of metropolitan legislative bodies at 20 members. In practice, that means Nashville. As of now, Nashville Metro Council has 40 members. 35 of those represent a district, and 5 at-large members serve countywide. The Metro government has vowed to challenge the new law in court. It is the latest step of what has been a growing battle between the state legislature and the city. Eli Maudica has been covering the story for the Nashville scene, and he joins us now. Eli, thanks for being here, and welcome back to This is Nashville.
Thanks, Khalil.
So, Governor Lee signed this bill with a quickness. What's your sense of how fast this all played out?
I've been hearing about it for 6 months at least. It's something that state lawmakers started, I don't know when they started talking about it, but it started to trickle through to journalists around August, September last year, after the RNC. There was a sense that a lot of state lawmakers were annoyed or angry with some of the decisions that Metro was making or wasn't making, specifically getting the approving or cooperating with getting the RNC, the Republican National Convention, here in 2024. Mm-hmm. Also, some, how slow the Titan Stadium negotiations have been going. They didn't like that. And several other, there's also just sort of seems like an interpersonal or kind of an animus that exists between largely conservative Republican state legislatures, or the largely Republican state legislature, and the Metro Nashville Davidson County Council.
So, we've got the third largest city council in the country at 40 members. Give us a little background on this council and why it's so unique.
In the late 50s, there was a county government, Davidson County government, and then there was a Metro Nashville government. There was a failed vote where they said, we should consolidate this. I think that was 57 or 58. And Beverly Briley was the first mayor of that consolidated city and county government, and that there was another vote, successful vote in 62, I think, 62, 63. And it's unique in that that single body presides over both the county, the Hall of Davidson County, and Metro Nashville, and it's consolidated in the sense that, unlike Shelby County, which has a county board, a county commission, and the city council, we just have one. Mm-hmm. It's Representative Harold Love spoke a little bit about his father, who was a charter member of that body back in the 60s, about how, there were lots of discussions at the time how to ensure fair representation among the city's different racial demographics, among the city's different geographic demographics, and how that 40-member body kind of formed out of a lot of conversations and a lot of negotiations, ultimately for the benefit of running a more efficient, more streamlined, consolidated body rather than having two operating side by side as there was, before 1962.
So this cut to 20 members, it's going to deeply affect not only who's represented, but how they're represented. Talk to me about how this will impact the council members themselves and their ability to do their jobs.
This is the huge conversation right now that everyone's trying to figure out. Once that state law was signed yesterday, it technically starts a 30-day clock for new districts to be presented and voted on by Metro Council.
30 days.
There's a planner, Gregory Claxton, who we're all thinking about right now. It's his job to figure out what those new districts would look like, and he has a small team of planners. He's in Metro's planning department. it's kind of the joke is that he's, locked in a room somewhere with a bunch of coffee and snacks, and he has to come up with probably one of the most important decisions in the past decade or few decades in Nashville city politics. How to draw 20 districts from 35, whether to draw 20, whether to draw 15 and have 5, be countywide at-large seats as there are now, whether to draw 17 and 3 at-large. Like, there's possibly come up with multiple scenarios that the council could vote on. The process of redistricting after the census in 2020, 2021, planning spent 6 months getting community input, trying to figure out where to draw these lines. When it comes to local government, it's like every street, every neighborhood, all of those little decisions and those lines. Like we see it play out in gerrymandering with congressional districts, but in city, it's even more down to that local level. Whether to draw incumbents in the same district so that they, 2 incumbents might be running against each other now with these new rules. How to figure all that out, that's kind of what is on the planning department right now, what Gregory Claxton's trying to figure out.
You said something about incumbents potentially running against each other. Later this year, we have elections coming up for many of the positions in city government. How would this new law, outside of these districts, how would it complicate this process?
There's a lot of uncertainty around this right now. Based on the law, there would have to be additional elections in 2024. So one of the big questions is if we have, it would complicate those elections because it would be, what are we going to not have them and extend members' terms for another year? If that's the case, some members have already indicated they would resign. They were preparing to leave. So would that create some special elections this summer? Then additional elections next year. Is that even legal? Because there's lots of different, these rules are already laid out and the governments, city and state governments have already been functioning based on rules for decades. The state deciding to change them up and throw a wrench into that whole process is, I guess, one of the biggest things that a lot of state lawmakers like State Senator Jeff Yarborough, State Rep Bob Freeman, a lot of them are bringing up on the floor this week, saying, You're throwing a huge complicating factor that is potentially illegal, potentially unconstitutional, violates the charter, violates the Tennessee Constitution, all these different scenarios. Everyone's trying to parse them right now to figure out elections this summer, special elections, extend terms. Is that even legal? An additional set of elections next year. This is the mess that Nashville-Davidson County is in right now.
It sounds like quite a mess. And another group to consider are people who may be interested in running for city council, who may have already done some investment and started their campaigns, and suddenly their district will no longer exist. So Metro Council has this legally binding charter. It's dating back to 1962, and it determines how Metro Council and the city operates. This law is coming into conflict with it. In what areas does it really butt heads against this?
I think one of the big things is that Jeff Yarborough brought up is that it violates the Tennessee state constitution, firstly, which indicates 4-year terms for local government representatives. There's also an exception, for Nashville in that state constitution that it now is going to come into violation with. And for current members, for people who have already started campaigns, maybe already started spending money for campaigns, they could potentially have grounds to then sue maybe Metro, maybe the state, to sue on their own behalf of saying, I was running a campaign, and now that campaign, the money that I spent, the time I put into it, the volunteers, it's meaningless because of this intervention that took place. So this is Wally Dietz, the Metro legal director. That challenge is expected to come probably on Monday, early next week. These are some of the things that I expect to see him outlining in that legal challenge against the state next week.
This is a real crazy legal and procedural quagmire, huh?
Yeah, it is. I'm glad that I'm not the one trying to figure it out.
I'm with you right there. People argue, and you mentioned this at the top, that this is another move by the state in this ongoing battle with Nashville, and it can seem like there's pretty petty reasons for all of this. What did the people you talked to for your story, what did they have to say about that tension? There
are a couple different camps. There's business owners, and a lot of them we might categorize as more conservative, business owners who say, we've had issues with the way that Metro's run. Maybe we've had issues with council members kind of poking holes in the functioning of the city government and saying things would be very abstractly, things would be a lot easier if there were only 12 or 15 members and they had staff and they had more money. And those are all moves that Metro is actually preparing to make too. We reported on yesterday, increasing salaries, increasing staff. So there's sort of people who don't like the way some of the decisions that Metro has made, challenging the new Titans Stadium. State legislators also don't challenge the Titans Stadium. Not cooperating with bringing the RNC here, which is not even clear if that would have been possible. But those state lawmakers who maybe are along more partisan lines, that's another camp who they like partying in Nashville. They like going out to dinner here. They like entertaining in Broadway or downtown. But there's real partisanship there where they see Nashville as the blue island in the red state, and they want to be a little petty, it seems like. And a lot of their defenses don't really go much further than saying Nashville doesn't run a good government. Leader Lamberth on Monday said Nashville's gouging it. He didn't say gouging, but Nashville's increasing its property taxes, and that's irresponsible, and it's not being economically responsible. So we have to intervene as legislators on behalf of the Tennesseans that live in Davidson County. You have those Tennesseans representatives, the Nashville representatives saying, this is ours to figure out. We've had votes. People want to keep this large council. You're coming in from other parts of the state, supposedly on our behalf. Why? Oh, they have the same questions. Why? Now,
you made reference to the legal challenge. Is there anything you're going to be keeping your eye on watching for there?
We've had a couple reporters and Nicole Williams, columnist at the scene, trying to figure out this exact question. So Stephen Elliott and I, he's at the Nashville Post, we were talking yesterday, basically thinking if you're a candidate and you already pulled papers, you've already started spending money, who sues who on what grounds? So I'm interested to see whether there are suits brought against Metro from a candidate's point of view, changing the playing field, changing the goalposts. And there's suits from Davidson County against Tennessee saying you're forcing us on a short timeline to basically refigure our entire city government.
Eli Modica is a staff writer for the Nashville Scene. You can find the link to his story on this episode's web post at thisisnashville.org. Eli, thanks for being on the show, and thanks for your reporting explaining this crazy stuff.
There's going to be plenty more soon, I'm sure.
Well, we'll see you soon.
Thanks, Cleo.
We have to take a short break. When we come back, we'll learn more about the Matthew Walker Comprehensive Health Center and how it puts the public in public health. Join the conversation and tweet us at This Is Nashville. We'll be right back.
Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Khalil A. Colonna, and this is Nashville. At the corner of Jefferson and 14th in North Nashville stands an institution that is dedicated to serving the health needs of the community. The Matthew Walker Comprehensive Health Center really does live up to its name. It offers medical care in pediatrics, family and internal medicine, dental care, services for women, and most importantly, health education. And everyone is welcome regardless of insurance status. The center is a part of the vision created by Dr. Matthew Walker, who dedicated his life to public health. My next guests know all about it as they are continuing the legacy of service set by Dr. Walker. Katina Beard is the CEO of the Matthew Walker Center. She is joined by Dr. Robin Mays, the center's assistant dental director, and Evelyn Wilson, the quality improvement manager over the patient-centered approach. Thanks to you all for being here today, and welcome to This Is Nashville.
Thank you. Glad to be here.
Really appreciate it. So, when I think about this medical center, the word that stands out to me is comprehensive. Taking a total approach to healthcare. Evelyn, talk to me about the model and why it's at the center of the work you all do.
So the PCMH stands for Patient-Centered Model, Patient-Centered Medical Home. And it is the model we use that places the patient in the center of their care. So what that means, we have the patient, and then they have an entire care team that coordinates their care to produce the best health goal for them.
How important is it to provide that wraparound care to people who are underinsured, or maybe uninsured?
It's very important in the way that it reduces and somewhat eliminates the social determinants of health that is prevalent in our community, especially the 37208 zip code. Why is that? That is because we connect, we don't just treat them for their health, but we connect them to resources. Mm-hmm. For instance, you have behavioral health. You have, if they need food, we have a nutritionist there. We have pharmacy. We have all the elements around them to help them be successful in their health goals.
Now, Dr. Mays, you help run the dental program at the center. Can you tell us more about those services?
So I am very happy to say that we have a wonderful dental program at Matthew Walker, and we truly are a comprehensive dental unit, yes. Being a piece of Matthew Walker. So if you come in and you need a cleaning, teeth removed, a denture, whatever you need, we're able to do. And that is a benefit for Matthew Walker because there aren't a lot of comprehensive health centers, number one, in Nashville in general, but those that offer dental services that are truly comprehensive. So we get referrals from some of our partners in the community for services that they just don't provide to their patients. So we provide anything from crown and bridge work, dentures, cleanings, extractions, anything you can really think of, we're able to provide for those patients, and especially those patients that typically would not be interested in dental care, those who couldn't afford dental care. And then with the whole TennCare expansion, we're able to get to those patients as well.
You mentioned people who may not be interested in dental care. And, anyone can get leery when having to go to the dentist. How do you calm people's anxieties? Mm-hmm.
Well, I think one of the true things about Matthew Walker is it's a family. And that is not only in the case of the employees, but it's also with our patients. So we are not only looking to serve their clinical needs, but we want to become true partners and create a relationship with our patient. And I think when you're working to create a relationship with your patient, then you're able to build trust. You're able to close those doors or knock down those barriers of anxiety and fear that they have, which makes them open to receiving that treatment and to trust the care that they're being given.
Does any patient come to mind who you got to see get more comfortable?
I actually have a patient, and I'm not going to name her name because she will kill me, because she was actually one of our board members, believe it or not. And she had just a fear of the dentist. She came in, she was tense, she was uptight. It took her probably 2 years, actually, to come in to see me. She said, Dr. Mays, I'm going to come. Dr. Mays, I'm going to come. So she finally came when maybe she had to at that point. But we were able to provide wonderful care for her. We create positive experiences. We like to turn a little music on, per the patient's request to calm them down. And we've been able to get her in a good place. Not that she was in really a bad dental place to begin with, but we were just able to ease her mind and her fears of some of the phobia she had around going to a dentist. She's actually no longer living in Nashville. And she feels comfortable and confident about finding a new dentist where she's at now. And so just being able to create those positive experiences is part of what makes being a dentist worthwhile.
Now, Katina, I want to talk to you about the center as a whole. It serves people who in other cases may not have access to quality medical care. How does the Walker Center impact the well-being for the community?
Sure. So, yes, our focus is absolutely to target those in our community that would not normally have access to care because they don't have an insurance plan. And so our structure is built so that people can afford services. Our whole goal and purpose is to be accessible and affordable. And so we have a sliding fee plan that individuals can sign up for, and it's based on their household income and the number of family members in their home. We also have staff that will help uninsured individuals try to find insurance to try to help ease that burden of cost of healthcare, because it's expensive. Even for those of us with a private plan, healthcare can get pretty expensive.
Very expensive. You know, part of Dr. Walker's mission was to serve people who lack consistent access to medical care. Talk to me about the people the center serves in the community.
Sure. So we are here to serve everyone, right? But we target those who don't have any insurance, who may not have access to health care. Our patients have been coming to us for generations. Our pediatrician can tell you that she saw a particular patient as a baby, and now they're bringing their babies. And not because they don't have anywhere else to go, not because they are uninsured, but because they trust in the services that we provide. And so our patients come to us because they want to be healthy, they want to be healthier. Some won't come to us because they are looking for a provider that resembles them. We are in that climate now where people are looking for providers that are African American or maybe non-English speaking or younger or even older. And so our patients, our staff represent and reflect our patient demographics. And so we are serving the entire generation of a family. We can serve the baby and the mom and the grandparents all at the same time. And so I think that that's also what's unique about our model, right? Is that the whole family can come in and be seen at the same time. And so we actually have created our Nashville clinic to be in that manner. So a new mom that's having a baby can come in. She's sitting right next to the clinic that serves the babies. And so the pediatrician goes next door to talk to her so that when she has the baby, she's already comfortable and has a pediatrician in mind that she can bring the baby back to. If the grandma is in the family or in the home, everybody's coming to our center at the same time. And so we're serving families.
Hit me to the process. Like if I have to come in for stitches, are you signing me up for other medical screenings, or are you just asking me questions and then we get to that?
No. We are giving you screenings because we are concerned about your entire well-being. And so we are going to assess your mental health. We're going to assess your weight. We're going to assess your tobacco use. And it's not to be intrusive, but we know how critical your time is. And so we don't want to keep bringing you back for one thing after the next. And so we want to be able to give you a complete picture of your health when you're there. So then we can determine a plan. In dental, they call it a treatment plan. In medical, they call it a care plan. And so what is it that we want to strive for together? And so again, as Evelyn discussed, the patient is in the middle of the discussion. And so what are your health goals that we can help you reach? And so if you come to us for a one-off, a stitch or, I got a sinus infection or whatever, we want to become your medical home at that time. And so let's engage in a discussion that helps you get healthier.
Now, Evelyn, how do people respond when they're offered more help?
They are honestly, they're very appreciative. They appreciate the one-stop shop, so to speak. The fact that they may be coming in for, say, an A1C check, but we will go ahead and not just do an A1C check. We will also do an eye exam. We will also check, of course, in checking their vitals, we'll make sure that they have an acceptable or a normal blood pressure reading. We also ask questions to see if we need to get them into our chronic care management program. That is a program that checks back with them. We don't just treat them, but we are on this journey with them. So we are in constant contact. Hey, how are you doing with your medication? How are you doing with the exercise goals that we agreed to? We are checking back. And they like that personal treatment. They like the fact that we care. We are with you on this journey, and we don't just want to treat you, but we want you to be healthier overall and improve your quality of life.
If you're just tuning in, this is Nashville, and I'm your host, Khalil Lekalona. We're talking this hour about the Matthew Walker Comprehensive Health Center with Katina Beard, Dr. Robin Mays, and Evelyn Wilson. Tweet us your comments at This Is Nashville. You know, it doesn't only treat people, but the center offers health education. Evelyn, tell me about some of the classes that you all hold there.
So we have what we call, it's called dial down diabetes. But what it does is for our patients and even people in the community that have what we call a A1C that's out of range, that's not normal. We have classes on how to check take your insulin, how to eat healthier, how to exercise, what to expect when you feel a certain way, when you need to contact your provider or your care coordinator. So we have those classes. We have hypertensive management classes as well. Am I missing something?
SALT. Seasoned Adults Living Triumphantly, which is our group for older adults that are 55 years old and older. Now, I am reaching 55, so I asked them to just go ahead and move that number up just a tinge.
Okay.
But SALT is our program that keeps our older adults connected in the community. And so I think during the pandemic, we all understood the importance of our social connectedness. And SALT does that. It encourages our older adults to stay active, to stay socially connected. And so in December, we, through funding, took them Christmas shopping. We just had a painting event with them this week. And so it really is our program that just really embraces our older adults in the community.
You know, reproductive health and education has really been in the spotlight since the Dobbs decision last summer. Evelyn, has the community shown an increased interest in learning more about reproductive health since that time?
Has the community shown interest?
Yes.
I can say this. I have not, yes, they have shown an interest. My department is more responsible for reaching out to make sure that, we're getting patients in to get them connected to, women's health services. So, that it has definitely been a discussion.
Excellent. Well, Dr. Mays, this public work in health, it's a lot of dedication and effort that you all are offering. Have you ever seen it impact a colleague in a profound way?
Absolutely. I mean, I can remember 8 years ago interviewing with Miss Katina Beard. And one of the things that we talked about, which kind of led me to decide it was a good fit, was having a servant heart. And that you really, truly have to desire to want to do the work that we do, to work in public health and to serve the patients that we serve, to be happy and for it to be successful. I have the privilege of running a residency program at the clinic, and I get new dentists who come in and they know what they want to do. This is a generation where they're like, I know what I want to do. I'm entitled to this thing. And I had a young doctor come in. It was actually our first year of the program, and he was set he was going to have this boutique practice. He had never really worked in community health, didn't really know the ride he was in for. And by the time he finished the program, not only did he not want to do what he thought he wanted to do, but he found his home in community health. He enjoyed the patients and the demographic that we were working with. He learned to have confidence in the skill set that was needed to be able to treat the patients that we see each and every day. And he now works at a community health center in Tampa, Florida.
All right.
So, we truly are committed to what we do. We don't change the minds or hearts of everyone because, there are a million things you can do, no matter what your career choice is. But we do want people to understand that there is a need to have providers that treat the patients that we see, and that we want providers who actually want to treat the patients that we see, because there is a difference. There is a difference. But one thing that we really pride ourselves on is that we don't want to be the provider that you have to come to. We want to be the provider that you choose to come to. And while we do see underserved and uninsured patients, we see everybody. So if you have private insurance, come to Matthew Walker. If you don't have insurance, come to Matthew Walker. But we really want to be the provider of choice and not the provider of have to.
You know, Katina, the center trains, more than 200 medical professionals per year, I understand?
Clinical professionals over the year. Yes, pharmacy, dental, medical, nursing. Absolutely.
What difference does that make in Nashville and beyond the city?
Yeah, so I think to Dr. Mays' point, right, we're training people in a model that is not necessarily shown them in the academic setting. And so most people think about going to work in a hospital or an emergency department or a private practice. And so being able to understand that the community health model exists in all 50 states, and it is very important to the fabric of that community. And so for us to be able to continue to train students in that way, it continues to extend the legacy of Dr. Walker. That was his foundation of teaching and making sure that people were prepared to go and to serve their communities. And so at the time of Dr. Walker's death, he had been acknowledged for training 50% of the African Americans that were physicians at that time. And so hearing Dr. Mays' story about our first cohort of dental residents that are working in community health centers today, it just makes my heart smile to know that we are continuing to teach and educate and encourage individuals to continue this work in a community health center, maybe not at Matthew Walker, but at a community health center near them to extend the quality of care. So all of our physicians, all of our dentists, all of our staff are highly trained. They are certified in their skill. They have years of experience. And so it is not, though, our staff are in any other way different than what you would receive in a private practice. And so to know that we are sending people, preparing servants to go out into the fields to serve other communities is inspiring to me.
I want to thank my guests for coming on the show to talk about the great work done at the Matthew Walker Comprehensive Health Center in North Nashville. CEO Katina Beard, Dr. Robin Mays, and Program Director Evelyn Wilson. Again, thanks you all so much for being here, and thank you for the work that you're doing.
Thank you.
Thank you.
Thank you.
We have to take a short break. When we come back, we'll learn more about the groundbreaking life of Dr. Matthew Walker from people who knew him well and one of his descendants. Have you heard about Dr. Walker? Tweet us at This Is Nashville. We'll be right back. I'm Khalil Ekolona, and this is Nashville. We're talking this hour about the legacy of Dr. Matthew Walker. Before the break, we were talking about the health center he started and the impact it's made on the lives of Nashvillians for more than 50 years. The Louisiana-born surgeon was educated and trained at Meharry Medical College. He then went on to be a leader in the city, emphasizing public health and training African-American physicians here and around the country. He was a man of many talents and interests. My next guests saw this firsthand as they grew up knowing Dr. Walker. I'd like to introduce Mary Ellen Forrester Hollins and her brother, Bill Forrester. Thank you both for being here today.
Good afternoon.
Thank you.
Wonderful. So, I understand, that your father, Dr. Bill Forrester, was best friends with Dr. Walker.
Joseph Forrester.
Joseph Forrester, pardon me.
That's right.
Bill, tell me, what do you remember about their friendship?
They were very, very close, and they shared a lot in terms of service to all people, regardless. And they conducted themselves in ways that would bring other gentlemen in. So it wasn't just my father, Joe Forrester, and Dr. Matthew Walker. There were several other physicians. And, for example, they traveled to different communities. They would set up an operation on a weekend in Fayetteville, Tennessee. They were constantly giving back, not only to Nashville, but there was a clinic that was run by Dr. Donaldson in Fayetteville. They would go there. They would go to Clarksville, Tennessee. And these were people that, for folks that could not afford medical care or coming into the major cities. the doctor there was a Dr. Panel, and they would open up a clinic, and my father was ear, nose, and throat surgeon. Dr. Walker was a surgeon, thoracic surgeon, internist, and they would see patients and help them out, for a short period of time. And they established mutual relationships in Lebanon, Tennessee, with a Dr. Glover. And so if you can understand, on certain weekends, they would take their time away from their families to go to these other areas. There was also a spot in Springfield. I just can't remember the name of it. But they gave back to the community.
In great ways, it seems like.
Great ways.
Now, Mary Ellen, I understand that you all spend a bit of time with Dr. Walker's family when you were growing up. What do you remember about those times?
Well, first of all, Dr. Walker and my father were family-oriented, and anywhere the adults went, the children were taken. I can remember spending so many events at the Walker Farm. It was on Silver Spring, Sulphur Creek Road. And Papa would say, okay, we're going on out with Maddie. He called him Maddie. Mm-hmm. And it was just like one big family. And, of course, Papa and Dr. Walker always said, the children are served first, and then the adults would be served. Mm-hmm. But there were some exciting times. Now, when we had firecrackers at our house. Christmas events were spent at our house. That was in the wintertime, because we would spend most of the time outside on the Walker's farm.
Okay. In the summertime. That must have been really beautiful.
Yes.
From what you remember, I'd like both of you to answer. What kind of man was Dr. Walker? Mary Ellen?
Well, he was very serious and was always helping people. I can remember when somebody in my family got her finger mashed in the door, and my father was not at home, and my sister was bleeding. The tip of her finger was mashed in the door, and Mama says, call Matthew. They lived on Macmillan Street. And within 5 minutes, Dr. Walker was there, picked up Mama and my sister. And my sister must have been about 3, 4. And the word got out. He just comes in with this little girl in his arms. I need the operating room. I've got to put this little tip back on her finger. When Papa got the news, it was, oh, Dr. Forrester's daughter's arm has been cut off. And Dr. Walker had to sew it back on. It was just all sorts of tales.
That's something else now.
Yeah.
Things go down the wire pretty quickly.
Right.
Bill, I understand Dr. Walker, he was an avid outdoorsman.
Extremely.
He loved hunting. You ever go out on a hunting expedition?
Yes. They were part, just about every day. They were Omega Psi Phi fraternity brothers. They were in the medical auxiliaries, the Sportsman's Club, the Apollo Club. They were always in the same clubs. And he hunted with his 2 sons, Matthew and Daniel, along with my brother, Joe, and myself. And it was an activity. Dr. Walker was not only a giving person, but he was an instructional person. He would communicate, and he wanted to help. And it's interesting, as far as the hunting went, when we hunted on properties, back then in the 50s and 60s. When you hunted, you had to have permission. And the black farmers in the neighboring communities allowed us to hunt And one of the conditions was kind of like a barter, you know. Can we hunt your property, and I'll see to it that Joe Forrester does your eyes, ears, and nose and throat.
Okay.
And I'll do the internal stuff, and we'll do the surgeries. It was a cooperative, but it was a joint cooperative. And yes, he was very much so a fisherman, a hunter, and just everything.
My next guest is a descendant of Dr. Walker who followed in his professional footsteps. Dr. Candace Coney is Dr. Walker's granddaughter, and she joins us now from Tampa. Dr. Coney, thanks for being here and welcome to This is Nashville.
Thank you so much. It's great to be here.
Really an honor to have you. How does it feel to have people honoring the legacy of your granddad?
It feels wonderful. I've enjoyed listening and to the conversation today, and of course beyond that, just the work that is being led by Katina Beard and the work that's being done by Dr. Mays and others. The staff, they're all remarkable, and so it's very appreciated. And of course, hearing from Mary Ellen and Bill, who I've known all my life, it is wonderful just to hear their perspective, their very personal perspective.
Well, tell me, what's one of your favorite memories about your granddad?
One of my favorite memories would probably be him spending time with us and his love of the outdoors and sharing that with us. So he once gave us an anatomy lesson on a raccoon that he shot. So he slit open the belly. He showed us where the bullets were. He showed us where, the organs were. And I was about 10 years old. And then he told me just to dig in there and take out the intestines. And I remember he said, just stretch it out. And I was really shocked to see how much of the intestines, how large they were inside of the animal.
Did his work, expeditions like that, doing, little anatomy lesson on a raccoon, and the work that he did on a daily, did that really inspire you to become a doctor yourself?
Absolutely. I've told some friends a story about, I remember as maybe I was 5 years old going to the hospital with him, and I was just so surprised because he couldn't make it around the corner because he was met by so many people who wanted to speak with him, and there were jokes flying, just back and forth, and he had so much. He was mobbed by people, and they were very loving, and it was just a lot to see when you're so small and seeing your grandfather welcomed in this way.
Let me ask you this. Did he know that you were hoping of becoming a doctor yourself?
I don't recall ever saying anything like that to him at the time.
Part of the beauty of having grandparents is that they offer us wisdom. I wonder, what words of wisdom did he share with you?
Well, I just very, very simple words to me. For example, I remember there was a time when my mother would paint pictures of him, and this time she was making a clay model of him to be displayed at the health center. And he liked to watch football. And so I had this idea. I was maybe 8. And I said, let me give Grandpa this mirror so he can look at the mirror and see the football game, because he had to hold still for my mother to make this model. And he said to me after I did that, he goes, Candy, you're a smart little girl. And just the way he said it, and he, looked at me, and he just made me feel important in that moment. So I say, he was like that with all the grandchildren. Give a little shout out. Branford Giddings is the oldest, Randy Giddings, and Matthew Walker III, Monica Nicole. He was very loving to all of us.
If you're just tuning in, this is Nashville, and I'm your host, Khalil Lekalona. We're talking this hour about the life and legacy of Dr. Matthew Walker with his granddaughter, Dr. Candace Coney, and longtime friends, Bill Forrester and Mary Ellen Forrester Hollins. Now, Dr. Walker made a lot of trips to Mound Bayou, Mississippi, a small rural black settlement followed by formerly enslaved people. He He saw a definite need there, and in 1974, he was interviewed by his friend and colleague, Dr. L.J. Bernard, about why he made those trips. Let's listen.
And I was going to Mount Bayou. We had four objectives. One was that we wanted to give a better health care delivery to the people in the area. Second, I wanted a place for my more advanced men in surgery. Third, we wanted to teach them about community health, preventive medicine, and that type of thing. And we also wanted to offer a place for the black doctors in the area to learn how to go in a hospital. Because at that time, black doctors had no hospital to go into. And the poor little fellows who finished medicine 10, 20 years previously didn't know how to write on a chart because it just wasn't permitted. And so that offered a place for them to go. And we'd hold conferences and seminars and that type of thing for all the surgeons and doctors in the area.
Mary Ellen, when you hear it in his own words, what comes to your mind?
Well, he believed that if we had a continuous checkup, then, and I guess that was his dream with the Matthew Walker Center, that there would be no need for long-term care and going to the hospital and just waiting so long for that service.
Mm-hmm.
And
he was a big part of the civil rights movement here. Can you tell us a little bit what he did for the movement?
Well, of course, his son Matthew and Maxine participated with the sit-ins. Dr. and Mrs. Walker, along with my mother and father and some other residents in Nashville, were responsible for finding people to post the bond for the sit-ins when they were arrested. I think they were in jail for about 2 weeks at a time, and during that time, it was lots of phone calls to people all over Nashville. Our numbers people did a wonderful job putting up money, and they said, "Hey," Papa would say, "Joe, Matthew, we got to hit everybody." And they were behind the scenes working.
Bill, I heard about another group of patients that he helped in a unique way, and it made him a so-called ghost surgeon.
Yes.
Can you tell us some more about what a ghost surgeon is and what Dr. Walker did in that regard?
That was a practice here in Nashville where folks like Dr. Walker and my father, Papa, for example, was ambidextrous. And he was an ear, nose, and throat surgeon. So when it came time for surgeries, he could operate equally as well with his right hand as well as the left hand, which made him very good. Dr. Walker, they had skilled hands, and there would be procedures that would take place in the other facilities that required skilled hands. And there had been some doctors that had recognized that there were some black physicians that were more skillful than they were. And they would come into the Vanderbilts, the St. Thomas's, the Baptist hospitals, and they would perform surgery. But they couldn't come in under staff because they were not staff. They would come in as, I used to think at one time it was guest, but from what I understand, they were really coming in as ghost physicians.
Ghost physicians.
And they would go in and perform the surgeries and correct everything. And there was a note when we were cleaning out my father's office that showed where someone was thanking him for this surgery that he had performed.
We have a minute left. Dr. Coney, when you hear about this, like your grandfather was so good that he was this ghost surgeon, tell us about him. Tell us about what you want us to remember about your grandfather today.
I would sum it up, and I think Bill, Mary Ellen, Katina, and Dr. Mays also have stated things beautifully. But Grandpa really was a community servant, and he, desperately wanted his community to thrive. And part of the key to thriving is having good health. The simple statement, your health is your wealth. And, you can't do much if you don't have basic health care. So he made it a point, along with other physicians and professionals in the area, to really try to get the community well and whole.
That is Dr. Candace Coney, granddaughter of Dr. Matthew Walker. She's joined by friends of the Walker family, Mary Ellen Forrester Hollins and Bill Forrester. I want to thank you all for being here. Thank you for sharing and telling us more about Dr. Walker's legacy.
Thank you.
Thank you.
We want to thank everyone who tuned in this hour. Next week, we're bringing you a rebroadcast from our episode from last year about Tennessee's 51-year sentence for juvenile murder convictions. The law was recently ruled unconstitutional. This is Nashville is a production of WPLN News and Nashville Public Radio. Listen back at thisisnashville.org or wherever you get your podcasts. Our producers are Steve Harouche, Rose Gilbert, and Magnolia McKay. Our digital lead is Anna Gallegos-Cannon. Michaela Elias is our technical director. Our executive producer is Andrea Tudhope. The masterminds behind our theme music are Larange and Namir Blade. Special thanks to Maddie Fox and Kathy Hunt. The conversation doesn't end here. Tweet us at This Is Nashville. Find us on Instagram and let us know what you want from our show by filling out our quick survey online. This is Nashville. I'm Khalil Ekalona. We'll see you next week, everybody, and be good to each other.